Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is the indications for spinal discectomy surgery for sciatica. Sciatica occurs in 1 to 2% of the population at any given point in time. Most people have no clue what they did as an inciting event. It's usually due to a slow disc degeneration that results eventually in a tear with the inner part squeezing out and pushing on a nerve root. The symptoms are the result of a pinched or irritated nerve root that gets inflamed. So just having the bulging disc or herniated disc pinching on a nerve root doesn't cause pain. It's the inflammation that it sparks up that can lead to leg pain, a burning or pins and needles sensation, numbness, sometimes some weakness like a foot drop, and rarely incontinence. Initial treatment should consist of a short period of bed rest. It used to be thought a week in bed was better. No, not anymore. Over-the-counter medications, anti-inflammatories, Tylenol, physical therapy, chiropractic, maybe spinal decompression therapy. Prescription medications may include Medrol dose pack, narcotics, muscle relaxers, neuropathic medications, and then interventional treatments like trigger point injections or epidural. Indications for sciatica surgery, there are 3 types of indications. One is absolute, meaning you gotta have it. Relative, which means probably you should have it. Or quality of life, which means it's totally up to the patient. All right, first the absolute. This is an unusual occurrence, but it's called cauda equina syndrome. It's when you have an extremely large disc herniation pushing back on the area just where the spinal cord ends, okay? Right up here, L1, L2, T12, in this neck of the woods. And what it can do is, if it's left to and not treated quickly enough, it can cause irreversible bowel or bladder problems, trouble walking, and so it should be treated within 24 hours maximum with a decompression to make sure that the changes are reversible. Now, relative indication would be if you have a neurologic problem. So if you have a nerve root that's it's getting pinched and it's causing a person's foot to not be able to work well, or the thigh not to be able to as strong as it was. Whatever the case may be, that's motor weakness, and it's unclear how long you can watch that before it'll get better with surgery. So for instance, if you watch it too long, like a year, it might be that you do a great surgery and it never gets better. So you got to be careful with how long you watch it. Now if it's getting progressively worse, like you partially had a problem lifting up your foot, but then you couldn't lift up your foot, that's getting worse, then it becomes more of a relative indication for surgery. Elective surgery for a herniated disc or sciatica is really if you've tried over 6 to 12 weeks of conservative therapy and it's just still unbearable, then consideration can be given to having the procedure if you've tried considerable conservative treatments. And this would consist, as we mentioned, of medications, PT, chiro. Here you see spinal decompression, maybe some injections. If none of that is working and the pain is horrific, then surgery can be considered as an elective indication. Less than 10% of individuals will need surgery for sciatica. Over 90% have good to excellent results with a discectomy. There was a landmark study in 2006, Journal of American Medical Association, that showed for those who had surgery versus those who didn't, the outcomes were identical at the 1-year point. Surgery did help increase mobility and decrease pain faster. The top non-operative pain management in Dallas is through the TEX-PAIN Network. There are several clinics throughout the Fort Worth, Dallas Metroplex area, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.